Much of the time, our next guest may have one of the best jobs in medicine. Dr. Kathy Slusher, OBGYN at Harrisonburg OBGYN, and often expert guest here at the station. Welcome, Kathy. So,
thank you.
Why should a potential patient who doesn't have an OBGYN might want to choose you if they are ready to start a family?
Well, we would be a good practice to choose because we do such a variety with our obstetrics. First of all, we have preconceptual planning, so we can go through the things you need to do to get ready for a pregnancy, and that's the ideal time to come and make your first visit. And then once the pregnancy ensues, we offer a nice variety. For people who have very normal pregnancies, want that low maintenance, low intervention, natural approach, we can do that, and we're very open to doing that. We do deliver at the hospital, but those rooms are just wonderful. They're very homey, they're very comfortable, they don't look sterile or not cool. They look very cool, as a matter of fact, and so you can have that experience and still have the opportunity to have the expertise of a physician taking care of your pregnancy. But then, say you have a very normal pregnancy and you want to be able to have epidural for pain control and a few other techniques for management, we can do that mid-level as well and do just fine through that pregnancy. But the other thing that's very important is if the pregnancy starts out or takes a turn where it becomes a little more high risk, whether it be twins, whether it be diabetes, either before the pregnancy or that comes on during the pregnancy, or high blood pressure and some of the problems that come along with that, or if there's a baby who's starting to show some fetal compromise being in the uterus, you know, we can manage those high risk situations as well and work with them. Of course, you know, we always have the opportunity to have perinatologists at our beck and call, if you will, that will help us manage anything that seems questionable or give us a second opinion. But you can stay right there and manage the pregnancy and work through that problem. And, you know, with the best of hope and good care, end up with a nice, normal, healthy baby and a healthy mom.
And that must be one of the coolest things in the world, is a big part of your job, bringing babies into the world.
I love it, and that's what drives me. You know, it's such a privilege to be invited to somebody's first birthday party.
Absolutely.
And I take that as an honor and a privilege when somebody does invite me into that situation. And, you know, I decided a long time ago, if I was going to stay up all night, I wanted to end up with a big prize and say, here it is, instead of maybe a lesser outcome.
Awesome. Let's talk about some of the other procedures that you do. You actually offer in-office anesthesia for some of the procedures that you do. What would be some of the things that you would do that would be helpful to a client to be able to do right there in your office?
Well, the main thing that we offer is for people who have heavy bleeding, whether it be with their periods or whether it be between their periods. But anyway, they've proven to have a benign condition that has a lot of heavy bleeding or growths in the uterus called polyps. And what we can do is put them to sleep right there in the office in our procedure room and either remove those polyps and then also do a procedure called a thermoablation, where we actually take care of the lining of the uterus right there with the surgical procedure to try to avoid that happening for them in the near or the distant future. As well, if there are small problems such as lesions that need to be removed but they're too big just to do, you know, locally there in the office, or if there's some other minor procedures that we do, minor sterilizations and a few other things that we can take care of right there with the patient asleep.
There are two other quick things that I would like for you to touch on that are kind of specialties for your practice. One is the urology services that you combine with your gynecological services, and also whole different demographic. You have some people that have a real passion for teenagers, and not only their bodies, but educating them.
Well, let's start with urogynecology. That's a specialty of gynecology that involves people that have incontinence or pelvic floor dysfunction or pelvic prolapse, meaning things are starting to fall out. And we at Harrisonburg OBGYN have the ability to evaluate that fully and decide the best approach, either medical or usually surgical, that will do the best for that patient. We even have in-office testing procedures that are high-tech that we can do to help us make those choices. And we have specialists within our group that can do some of those powerful surgeries that restore that pelvic floor. So that is something that we really bring that's very unique and exciting to the community, especially to the older female community. And as you said, on the counter side of that, we love our teenagers and our young folks. And our nurse practitioners have a big passion for the teenagers and those adolescents, and they're right there to help them. You know, as young girls go from through that whole puberty and early developmental process, they're there to talk them through it, help them understand it, and kind of do something just a little bit different than what mom does.
And what a huge difference to get young women started out on the right foot, taking care of their bodies. Thank you so very much, Kathy. When we come back, we will be looking at eye surgery procedures that are making it so much easier for patients.
6 board-certified physicians and 2 nurse practitioners to cover your women's health needs with compassion and care. 40 years of experience in women's health and thousands of healthy babies. At Harrisonburg OBGYN, we utilize the latest technology in women's medicine, gynecology, and obstetrics right here on site, so we can address all your needs in a comfortable and familiar environment. Harrisonburg OBGYN, committed to women's health and our community. For answers to all of your women's health concerns, call 540-434-3831.